Welcome to the SWAYAM NPTEL course on food microbiology for safe and sustainable food systems. In the last few classes, we have seen the microbial food spoilage, and now in this class onwards, we will be seeing the diseases by food-borne microbes, and the first lecture would be food-borne illnesses. And we shall in this class we shall try to find out the answers of these questions, like what are food-borne illnesses, what causes food-borne illnesses, who gets food-borne illnesses, what are the symptoms of food-borne illnesses, what are the complications of food-borne illnesses, when should people with food-borne illnesses see a health care provider, how are food-borne illnesses diagnosed, how to manage diet and nutrition, how are food-borne illnesses prevented. The food-borne illnesses are infections or irritations of the gastrointestinal tract caused by food or beverages that contain harmful bacteria, parasites, viruses or chemicals. The gastrointestinal tract is a series of hollow organs joined in a long twisting tube from the mouth of the anus. Common symptoms of food-borne illnesses include vomiting, diarrhea, abdominal pain, fever and chills. Most food-borne illnesses are acute, meaning they happen suddenly and last a short time, and most people recover on their own without treatment. Rarely, food-borne illnesses may lead to more serious complications. Each year, an estimated 48 million people in the United States experience a food-borne illness. Food-borne illnesses cause about 3,000 deaths in the United States annually. This figure shows that almost 1 person in every 10 people fall ill due to food-borne diseases. About 30 million healthy life lost every year. The food-borne diseases can be deadly, especially in the children who are less than 5 years of age. About 4,20,000 deaths are there in 2015, and out of these deaths, about children account for 1/3 deaths due to food-borne diseases. What are the causes of food-borne diseases? The majority of food-borne illnesses are caused by harmful bacteria and viruses. Some parasites and chemicals also cause food-borne illnesses. This is the pictorial representation of what are the different items which cause the food-borne illnesses. The first is bacteria. Bacteria are tiny organisms that can cause infections of the gastrointestinal tract. Not all bacteria are harmful to humans. Some harmful bacteria may already be present in foods when they are purchased. Raw foods including meat, poultry, fish and shellfish, eggs, unpasteurized milk and dairy products and fresh produce often contain bacteria that cause food-borne diseases. Bacteria can contaminate food, making it harmful to eat at any time during growth, harvesting or slaughter, processing, storage and shipping. Foods may also be contaminated with bacteria during food preparation in a restaurant or home kitchen. If food preparers do not thoroughly wash their hands, kitchen utensils, cutting boards and other kitchen surfaces that come into contact with raw foods, cross contamination, that is the spread of bacteria from contaminated food to uncontaminated food may occur. If hot food is not kept hot enough or cold food is not kept cold enough, bacteria may multiply. Bacteria multiply quickly when the temperature of food is between 4 to 60 degrees Celsius. Cold food should be kept below 4 degrees Celsius and hot food should be kept above 60 degrees Celsius. Bacteria multiply more slowly when food is refrigerated, and freezing food can further slow or even stop the spread of bacteria. However, bacteria in refrigerated or frozen foods become again active when food is brought to room temperature. Cooking food thoroughly kills bacteria. Many types of bacteria cause foodborne illnesses. Examples include Salmonella, a bacterium found in many foods, including raw and undercooked meat, poultry, dairy products, and seafoods. Salmonella may also be present on eggshells and inside eggs. Campylobacter jejuni, found in raw or undercooked chicken and unpasteurized milk. Shigella, a bacterium spread from person to person. These bacteria are present in the stools of people who are infected. If people who are infected do not wash their hands thoroughly after using the toilet, they can contaminate food that they handle or prepare. Water contaminated with infected stools can also contaminate produce in the field. Clostridium botulinum, a bacterium that may contaminate improperly canned foods and smoked and salted fish. Vibrio, a bacterium that may contaminate fish or shellfish. A virus. Viruses are tiny capsules much smaller than bacteria that contain genetic material. Viruses cause infections that can lead to sickness. People can pass viruses to each other. Viruses are present in the stool or vomit of people who are infected. People who are infected with a virus may contaminate food and drinks, especially if they do not wash their hands thoroughly after using the toilet. Common sources of foodborne viruses include food prepared by a person infected with the virus, shellfish from contaminated water, produce irrigated with contaminated water. Common foodborne viruses include novovirus, which causes inflammation of the stomach and intestines, hepatitis A, which causes inflammation of the liver. Now, parasites. Parasites are tiny organisms that live inside another organism. In developed countries, such as the United States, parasitic infections are relatively rare. Cryptosporidium parvum and Giardia intestinalis are parasites that are spread through water contaminated with the stools of people or animals who are infected. Foods that come into contact with contaminated water during growth or preparation can become contaminated with these parasites. Food preparers who are infected with these parasites can also contaminate foods if they do not thoroughly wash their hands after using the toilet and before handling food. Trichinella spiralis is a type of roundworm parasite. People may be infected with this parasite by consuming raw or undercooked pork or wild game. Chemicals. Harmful chemicals that cause illness may contaminate foods such as fish or shellfish, which may feed on algae that produce toxins, leading to high concentrations of toxins in their bodies. Some types of fish, including tuna and mahi-mahi, may be contaminated with bacteria that produce toxins if the fish are not properly refrigerated before they are cooked or served. Certain types of wild mushrooms of genus Amanita. The adjacent figure shows the different types of Amanita mushrooms. Unwashed fruits and vegetables that contain high concentrations of pesticides. These are the causes of foodborne diseases like bacteria, for example, Salmonella, Campylobacter, Escherichia coli, Vibrio cholera, Listeria, Staphylococcus, Clostridium perfringens and Clostridium botulinum, Bacillus cereus. Among the viruses, Novavirus, Rotavirus, Hepatitis A and Hepatitis E virus are important. Among the parasites, for example, Entamoeba histolytica, Giardia lamblia, Cryptosporidium, fish-borne trematodes, Echinococcus species, Taenia solium and Taenia saginata, Ascaris lumbricoides, and the toxins, which includes the mycotoxins generally produced by aflatoxins. Mycotoxins, for example, aflatoxins, marine biotoxins, mushroom toxins, shellfish toxins and plant toxicants. The chemicals like pesticides, polychlorinated biphenyls, heavy metal nitrides, for example, of lead, cadmium, mercury, copper. Now, who gets foodborne illnesses? Anyone can get a foodborne illness. However, some people are more likely to develop foodborne illness than others, including infants and children, pregnant women and their fetuses, older adults, people with weak immune systems. These groups also have a greater risk of developing severe symptoms or Complications of foodborne illnesses. Now, what are the symptoms of foodborne illnesses? Symptoms of foodborne illnesses depend on the cause. Common symptoms of many foodborne illnesses include vomiting, diarrhea or bloody diarrhea, abdominal pain, fever, chills. Symptoms can range from mild to serious and can last from a few hours to several days. Now, the Clostridium botulinum and some chemicals affect the nervous system, causing symptoms such as headache, tingling or numbness of the skin, blurred vision, weakness, dizziness and paralysis. The adjacent figure shows pictorial representation of different symptoms of botulism. Now, what are the complications of foodborne illnesses? Foodborne illnesses may lead to dehydration, hemolytic uremic syndrome, that is HUS, and other complications. Acute foodborne illnesses may also lead to chronic or long lasting health problems. Dehydration. When someone does not drink enough fluids to replace those that are lost through vomiting and diarrhea, dehydration can result. When dehydrated, the body lacks enough fluids and electrolytes, minerals in salts including sodium, potassium and chloride to function properly. Infants, children, older adults and people with weak immune systems have the greatest risk of becoming dehydrated. Signs of dehydration are excessive thirst, infrequent urination, dark colored urine, lethargy, dizziness or faintness. Signs of dehydration in infants and young children are dry mouth and tongue, lack of tears when crying, no wet diapers for 3 hours or more, high fever, unusually cranky or drowsy behavior, shrunken eyes, cheeks or soft spot in the skull. Also, when people are dehydrated, their skin does not flatten back to normal right away after being gently pinched and released. Severe dehydration may require intravenous fluids and hospitalization. Untreated severe dehydration can cause serious health problems such as organ damage, shock or coma, which is a sleep-like state in which a person is not conscious. Now, HUS, that a hemolytic uremic syndrome is a rare disease that mostly affects children younger than 10 years of age. HUS develops when E. coli bacteria lodged in the digestive tract make toxins that enter the bloodstream. The toxins start to destroy red blood cells, which help the blood to clot and the lining of the blood vessels. In the United States, E. coli 0157H7 infection is most common cause of HUS, but infection with other strains of E. coli, other bacteria and viruses may also cause HUS. A recent study found that about 6% of people with E. coli 0157H7 infections developed HUS. Children younger than age 5 have the highest risk, but females and people age 60 and older also have increased risks. Symptoms of E. coli 0157H7 infection include diarrhea, which may be bloody, and abdominal pain, often accompanied by nausea, vomiting, and fever. Up to a week after E. coli symptoms appear, symptoms of HUS may develop, including irritability, paleness, and decreased urination. HUS may lead to acute renal failure, which is a sudden and temporary loss of kidney function. HUS may also affect other organs and the central nervous system. Most people who develop HUS recover with treatment. Research shows that in the United States between 2000 and 2006, fewer than 5% of people who developed HUS died of the disorder. Older adults had the highest mortality rate. About 1/3 of people aged 60 and older who developed HUS died. When should people with foodborne illnesses see a health care provider? People with any of the following symptoms should see a health care provider immediately: signs of dehydration, prolonged vomiting that prevents keeping liquids down, diarrhea for more than 2 days in adults or for more than 24 hours in children, severe pain in the abdomen or rectum, a fever higher than 101 degree Fahrenheit, stools containing blood or pus, nervous system symptoms, signs of HUS. If a child has a foodborne illness, parents or guardians should not hesitate to call a health care provider for advice. How are foodborne illnesses diagnosed? To diagnose foodborne illnesses, health care providers ask about symptoms, foods and beverages recently consumed, and medical history. Health care providers will also perform a physical examination to look for signs of illnesses. Diagnostic tests for foodborne illnesses may include a stool culture, in which a sample of stool is analyzed in a laboratory to check for signs of infections or diseases. A sample of vomit or a sample of the suspected food, if available, may also be tested. A health care provider may perform additional medical tests to rule out diseases and disorders that cause symptoms similar to the symptoms of foodborne illnesses. If symptoms of foodborne illnesses are mild and last only a short time, diagnostic tests are usually not necessary. How to manage diet and nutrition? The following steps may help relieve the symptoms of foodborne illnesses and prevent dehydration in adults. Drinking plenty of liquids such as fruit juices, sports drinks, caffeine-free soft drinks, and broths to replace fluids and electrolytes. Sipping small amounts of clear liquids or sucking on ice chips if vomiting is still a problem. Gradually reintroducing food, starting with bland, easy to digest foods such as rice, potatoes, toast or bread, cereal, lean meat, apple sauce and bananas. Avoiding fatty foods, sugary foods, dairy products, caffeine and alcohol until recovery is complete. Infants and children present special concerns. Infants and children are likely to become dehydrated more quickly from diarrhea and vomiting because of their smaller body size. The following steps may help relieve symptoms and prevent dehydration in infants and children. Giving oral dehydration solutions such as Pedialyte, Neutralite, Infalite and Cerelite to prevent dehydration. Cerelite giving food as soon as the child is hungry. Giving infants breast milk or full strength formula as usual along with oral rehydration solutions. Older adults and adults with weak immune systems should also drink oral rehydration solutions to prevent dehydration. How are foodborne illnesses prevented? Foodborne illnesses can be prevented by properly storing, cooking, cleaning and handling foods. Raw and cooked perishable foods, the foods that can spoil should be refrigerated or frozen promptly. If perishable foods stand at room temperature for more than 2 hours, they may not be safe to eat. Refrigerators should be set at 4 degrees Celsius or lower and freezers should be set at 0 degrees Celsius. Foods should be cooked long enough and at a high enough temperature to kill the harmful bacteria that cause illnesses. A meat thermometer should be used and to ensure foods are cooked to the appropriate internal temperature. 63 degrees Celsius for roasts, steaks and chops of beef, veal, pork and lamb, followed by 3 minutes of rest time after the meat is removed from the heat source. 71 degrees Celsius for ground beef, veal, pork and lambs. 74 degrees Celsius for poultry. Cold foods should be kept cold and hot foods should be kept hot. Fruits and vegetables should be washed under running water just before eating, cutting or cooking. A produce brush can be used under running water to clean fruits and vegetables with firm skin. Raw meat, poultry, seafood and other juices should be kept away from other foods. And after handling raw meat, poultry, fish, shellfish or eggs, people should also wash their hands after using the toilets, changing diapers or touching animals. Utensils and surfaces should be washed with hot soapy water before and after they are used to prepare food. Diluted bleach, that is 1% of bleach to 1/4 of hot water, can also be used to sanitize utensils and surfaces. This is a case study which has been suggested by the US to the US travelers to avoid the travelers' diarrhea. People who visit certain foreign countries are at risk for travelers' diarrhea, which is caused by eating foods or drinking water contaminated with bacteria, viruses or parasites. Travelers' diarrhea can be problem for people traveling to developing countries in Africa, Asia, Latin America and the Caribbean. Visitors to Canada, most European countries, Japan, Australia and New Zealand do not face much risk for travelers' diarrhea. To prevent travelers' diarrhea, people traveling from United States to developing countries should avoid that drinking tap water, using tap water to brush their teeth or using ice made from tap water, drinking unpasteurized milk or milk products, eating raw fruits and vegetables including lettuce and fruit salads unless they peel the fruits or vegetables themselves, eating raw or rare meat and fish, eating meat or shellfish that is not hot when served, eating food from street vendors. Travelers can drink bottled water, bottled soft drinks and hot drinks such as coffee or tea. People concerned about travelers' diarrhea should talk with the healthcare provider before traveling. The healthcare provider may recommend that travelers bring medication with them in case they develop diarrhea during their trip. Healthcare providers may advise some people, especially people with weakened immune systems, to take antibiotics before and during a trip to help prevent travelers' diarrhea. Early treatment with antibiotics can shorten a bout of travelers' diarrhea. These are the certain points to remember, or you can say that this is the, in nutshell we can say that the food-borne illnesses or infections or irritations of the gastrointestinal tract caused by food or beverages that contain harmful bacteria, parasites, viruses or chemicals. Anyone can get a food-borne illness. However, some people are more likely to develop food-borne illnesses than others, including infants and children, pregnant women and their fetuses, older adults and people with weakened immune systems. Symptoms of foodborne illnesses depend on the cause. Common symptoms of many foodborne illnesses include vomiting, diarrhea or bloody diarrhea, abdominal pain, fever and chills. Foodborne illnesses may lead to dehydration, hemolytic uremic syndrome and other complications. Acute foodborne illnesses may also lead to chronic or long lasting health problems. The only treatment needed for most foodborne illnesses is replacing lost fluids and electrolytes to prevent dehydration. Foodborne illnesses can be prevented by properly storing, cooking, cleaning and handling foods. These are certain control and prevention of foodborne illness diseases. First, to adopt good manufacturing practices, that is the GMP, to ensure the food safety and quality following GMP guidelines. Maintain a clean and organized production environment. Regular staff training on GMP compliance. The second is to implement hazard analysis and critical control points. To conduct thorough risk assessment in food processing. Develop and follow preventive measures to safeguard food quality and monitor and control each critical point in the production process. The third prevention application is emphasize personal hygiene. Encourage regular hand washing and use of protective gear among food handlers. Maintain high standards of cleanliness to prevent contamination. Educate staff on the importance of personal hygiene in food safety. And lastly, to ensure proper food handling, storage and cooking techniques. Store food at appropriate temperatures to inhibit microbial growth. Implement thorough cooking methods to eliminate pathogens. Follow safe food handling practices from preparation to serving.